Well, it may be hard to talk about, but September has been declared National Suicide Prevention Month, a month aimed at helping those who need it most, but those who may be suffering in silence. Kate Nemrich joins us live now in studio to tell us more about the signs that you need to be aware of.
Sydney, this month is about raising awareness and ending stigma surrounding suicide. More than 47,500 people in the U.S. died by suicide in 2019. Suicide is actually the second leading cause of death for people aged 10 to 34, which is why advocates want all of us to know how to help others and ourselves.
The importance of this is we're losing people every day to suicide. We are losing 1,200 Tennesseans every year, and for every one of those deaths, there is 120 other folks that are attempting suicide.
KRISTY TIPTON, Division Director of Crisis and Specialty Services for Frontier Health, says there are certain more obvious warning signs that we can look out for.
People really just kind of closing out the relationship, saying goodbye, maybe offering some of their most precious items to other people that they care about, saying that they don't want them anymore.
Morgan Tubbs with Tennessee Suicide Prevention Network says be compassionate and put aside your judgments if you're concerned a loved one will hurt themselves.
You should be direct. That's part of that non-judgment, because it's not this like scary taboo thing. I mean, it's a reality that is a public health issue.
However, Tipton says sometimes our loved ones don't give us any signs to act on.
Something gets missed, or they have chosen not to say anything. There are folks out there that isolate and just don't give some of that to certain loved ones that would maybe reach out to help them.
Advocates say we need to be cautious of how we speak about suicide to not place blame on anyone.
When you say death by suicide versus someone committed suicide, saying someone committed something kind of puts the blame on that person. And it's really not that person's fault. It's no one else's fault either. Unfortunately, people die by suicide every day because of mental illness and because of situational stressors that they just don't see a way out.
The most important thing for anyone to do is to seek help.
A big part of suicide prevention is, on the front end, breaking stigma, having these conversations, not being afraid to have them, being vulnerable, and not judging others when they, are struggling.
If you or a loved one need help, there are both national and local crisis lines that you can call at any time. Frontier Health also has a walk-in center located in Johnson City, open 24/7. I'll have all of those resources I just mentioned up on WJHL.com, as well as warning signs and other information. As both Tipton and Tubbs stress, there is no shame in seeking help or reaching out to a loved one who you think is struggling.